Hello everyone, and welcome to this audio which is specifically an audio sort of an overview in relating to or regards to sort of current works that surround the renal patient support group, or the RPSG, and then also the kidney disease and renal support group, or KDARS, for kids. And this audio and sort of slide set overview provides sort of an sort of a summary in context of works that have been sort of semi-finalized and finalized, but also wherein there's an overview in context of some prospective work. And so I thought I'd take a little bit of time, or a little bit of this sort of opportunity to us to provide an overview in this context. And in line with this, we would the RPSG team and the KDARS team would love it, basically, if members are between the two sort of organizations and platforms could actually get involved in aspects that will be highlighted, and throughout that will be highlighted in this works. And Again, with this audio, I'll take this opportunity to provide the audio, this audio in context of other works that are linked with KDARS and the RPSG across the different social media platforms, respectively. Okay, so um, the premise of this overview, perhaps first and foremost, is to provide an overview in context of prospective works, which will look at online education with sort of involvement surrounding allied health professionals, or AHPs, for healthcare and bridging gaps between pediatric and adult nephrology appointments. And Once again, the link is between the RPSG and KDARS. And so before I begin, the as part of this overview, a bit of a forward, is that the information outlined in the following slides, in context of prospective research, that is based on online education with allied health professionals for healthcare, uh, and in line with that, in line with this perspective work, that the slide set that will be part of this, and the outline are all linked, in keeping with the prospective research and the context thus far. So to begin with, there's I wanted to highlight, as part of the prospective research, or the prospective work that links between a pediatric and adult nephrology, no, pediatric and adult nephrology perspectives, or social media platforms. This slide is an overview of work that has already been conducted. The research has finalized around this. The works had been peer reviewed and published. This was works that looked at integrating healthcare education for best practice, and a question of which health professionals between pediatric and adult CKD patients, and it was where collaboratively between the RPSG and KDAR's team. There was a duration of activity where there was topic tagging that was being conducted to really identify which topics were most common amongst and between pediatric nephrology and adult nephrology cohorts or groups, and also in line with this to identify the sort of a sort of to also identify specific themes that were also linked to the works. And so there were the abstract, or the sort of summary, so to speak, is on this slide, and you're welcome to use the sort of timestamp to kind of read through this works. But this work has been peer reviewed, and it has been published. It was published in 2021, so not long ago. And the next one, and in the work that followed after that, was something that was a little bit something a little bit more exciting in some way, and also links with the prospective research, which I will highlight in a bit more detail. But basically, where between the two social media platforms, having identified that between the two social media platforms there were a number of sort of, for example, artworks being posted, and the artworks had been posted between 2000 around 2015 to around 2021 or 2022, so sort of more currently or more recently. And basically, in and around 2015 up to 2000, in around mid 2000 and 2021. And so what the teams did between the RPSG and KDARS was, where the art that had been posted that linked to particular aspects that surround different sort of discussions or threads, if you like, had anonymously been anonymously put together in a form of two different art books. There was some funding. Through an enterprise scholarship that the RPSG team had won in around 2021. And basically the works, the funding helped develop these two different art books, wherein retrospectively art had been sort of collated between the two social media platforms in sort of retrospectively, as mentioned. And so two art books had developed, wherein alongside with the art there were themes that had been linked with the art, and also where, as mentioned, there were particular threads or discussions that were linked with the art as well. And anonymously, the art had anonymously the art with particular themes and context had been put together in between two different art books. So one of the art books is known as CKD and evidence-based through art, evidence-based through investigation, and that's CKD art book side A. And then there's CKD science through art, using art to raise CKD research through awareness, which was CKD art book side B, and basically the the sort of abstracts on both of these books are is on this slide as well. And so with the prospective research, I will be highlighting how the art books will be linked are linked with the prospective research as well. So moving on to the next slide. So um, here is a slide that relates just as a cover image really to art book side A, and here's on this slide is a cover image of art book side B. And so both of these books, or these art books, have actually been have been published, and between the RPSG and KDAR's teams, there are hard copies of these art books that can and could be made available as part of the prospective works, but also there's electronic copies of the art books as well. So in line with this also, there's works that was that had been developed sort of retrospectively, looking at renal medicine and renal pharmacy from a retrospective perspective, and the importance of renal diagnostic screening, which which I'm sure that many who may be listening to this particular audio would know that it's important. Generally speaking, the works has been published in context of a slide set that is available on the RPSG on the one of the RPSG YouTube channels. So feel free to check the slide set at your own times. But generally speaking, again, the works sort of abstract or synopsis can be identified in this slide. And so again, whilst the slide set is generally sort of retrospective, there have been a few updates that have been included in part of this work as well. And in regards to the sort of works that were in linking with the same theme in and around the importance of renal diagnostic screening, the works that also that was developed in the same sort of time era, was basically where we were looking at renal medicine and renal pharmacy and the facts about primary and secondary care. And so again, the full works around this has been developed in by way of a slide set, which again is available on one of the RPSG YouTube channels. The overview can be seen here as well in a form of a synopsis. And again, whilst the slide set is retrospective, again there are a few updates in and around this in and around the slide set on YouTube as well. So this then brings me into more current works, sort of again in collaboration between the RPSG and KDAS, and this is works that was also done sort of at a similar time, a similar time to the works around the topic tagging sort of research that took place last year in 2021. And this work was this work is sort of themed and titled as Integrating Healthcare Education for Practice Excellence, a quantitative sort of perspective wherein data had been collected to identify between four different between patients and professionals generally, and those who and wherein there was a survey link that was placed on the RPSG for a certain number of months, and wherein the descriptive analysis had been done to identify the 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 sort of the bases between different descriptors and aspects that were in the survey, and this works has now been put forward for peer review, and again it links to the prospective research that I will come into. And so that works then links into the works that is works and sort of wherein 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 the next the wherein this works looks at sort of educational support surrounding chronic kidney disease, and looks at this work from a qualitative inquiry. And so this works had in line so a little bit different from the quantitative research, in context of where the quantitative research had involved a survey implementation. Here, this works involved conducting particular interviews with four different cohorts or groups of people. So we had, for example, the works had general practitioners, it had healthcare scientists, it had nephrologists and clinicians, and it had patients. Chronic kidney disease patients as well. And so nine themes have been derived between both professional healthcare professionals and patients, and something that's referred to as inductive content analysis took place to ultimately form appropriate conclusions, summaries and conclusions around this work. So this work has again been put forward for peer review. Both this work or this research, along with the research that involved topic tagging, both of those works involved something that's related to patient and public involvement, wherein back in around May 2019 and June 2019, between the KDAS team and the RPSG team, We did there were workshops that took place to identify really some of the most important some of the important sort of topics again that members between the two social media platforms find that it's important that both professionals and patients are involved in. And so um, the works altogether highlight sort of an overview of how the current research, or the research that has I'm going to now make mention of, are all linked to that research. So so basically with this works, which is at the moment being referred to as online education with allied health professionals for healthcare and bridging gaps between pediatrics or young people and adult nephrology appointments. And ultimately what the team are looking to do between the two social media platforms is to seek out initially 10 to 20 members between the RPSG and KDAS. So there's a pediatric cohort of people and an adult and an adult cohort to get involved and participate in hopefully an exciting project, or a project an exciting project wherein you can share lived experience regarding the following themes. So there are 14 main themes, and these themes were themes that have been identified through the topic tagging activity that has been evidenced and published. And so they were again around lab tests and biomarkers, biopsy and surgery, diet and nutrition, renal replacement therapy, psychology and related, medication and pharmacy, lifestyle, primary care, wellness and well-being, nursing, exercise or physical activity, educational and interactive, peer support, and COVID-19 and infections. And so we're looking for the team is looking to have between 10 and 20 members between the RPSG and KDAS to highlight different sort of experiences around these different these themes, and wherein we're following previously co-developed work between the two social media platforms, RPSG and KDAS. The teams are seeking participants to get involved in either an anonymous sort of phone calls, where there be one-to-one a one-to-one phone call, where that phone call will be recorded, much like a phone call interview, and or to get involved in an MS Teams call or a Zoom call, instead, for example. And so, depending on involvement, each participant will get a free electronic copy of of either one of the CKD through art book publications, wherein linked to each theme, participants will be able to place notes according to each of the different themes. And once again, as in previous works, your any involvement around any involvement would be appreciated around. And so one of the or a few of the main sort of outcomes in regarding this in regarding and relating to this works is to number one, one of the ideas would be to co-develop efforts between the RPSG and KDAS, and wherein both excuse me, wherein both patients and allied health professionals, or AHPs, provide insights surrounding above highlighted themes. Number two is to use CKD art books as a way to document between themes and by way of linking notes to electronic patient records according to those particular themes. And number three, wherein a KDAR's a prospective KDAR's YouTube channel would be co-developed between the RPSG and KDAR's team, and so where that could be affiliated with onto the RPSG website and linked so that it integrates sort of the practices in and around highlighting some of the most important perspectives, so to speak, in and around the in and around the themes, and also where it can be the YouTube channel that would be in line with KDAR's would be so that it can be used as a point of reference as well. And so once again, if you would like to be involved, do contact, get in touch, and your involvement would be appreciated. If you are formally intrigued to get involved, you can email. You can get in touch in a few ways. So number one, you can contact the RPSG through the email address info@rpsg.org.uk, and one of the colleagues will look into will look to answer and support answer the emails in that regard. And you could get in touch with myself through my academic email address, which is on this slide as well. Or you can get in touch with Heather Christine, who is the lead for the kidney disease and renal support group, or KDAR's group for kids, and the email address is here on this slide. So so another way another way would be, apart from, so there's whilst email contacting by email may well be preferential if you're already on social media, for example on Facebook, or on Facebook, for example, where these two social media platforms are mainly, then you're welcome to contact Heather Christine through KDAR's or through the RPSG, and also you can contact Camilla. Camilla is and was one of the main sort of one of the sort of second in command in context of developing some of the original works that has linked between RPSG and KDAR's as well. So you're welcome to contact either Camilla and Heather directly. But again, the email addresses and contacts are on this slide if anyone wants to get in touch directly. Once again, I hopefully through this there is some hopefully through this members between RPSG and KDAR's would find it of intrigue, and